Hi, it's Dr. John Raymond Baker, DC, and today I want to talk about a topic you may not see a lot on the major news networks, and maybe there's a good reason you're not seeing a lot about it. That is the notion of a post-antibiotic apocalypse. Now, what the heck is that? Well, it's the notion that we're quickly headed toward a time when the antibiotics that we've traditionally used against diseases will no longer work because the diseases have become resistant to these antibiotics. Now let's take a case in point. You had something called Staph aureus, which is a widespread bacteria, and a lot of times you have problems with people in hospitals becoming infected with Staph aureus because it's an opportunistic infection for immunologically compromised individuals. Now, methicillin used to take care of Staph aureus, but at some point a strain evolved that did not respond to methicillin, so it was called Methicillin Resistant Staph Aureus, also known as MRSA, MRSA. That started off kind of a cavalcade of other cases where slowly but surely more and more bacteria especially are becoming resistant to the drugs that we've been using to treat them. Now, occurring alongside that is a long-standing tradition of farmers who found a long time ago that if you add antibiotics to the feed of livestock, they'll put on meat and fat a lot quicker. So you can take cattle without antibiotics, just feed, cattle antibiotics with their feed, and you'll find out that soon the antibiotic-fed cattle are putting on a lot more weight, and you can get more money and get more money quicker for sale of those cattle. Now, the overuse, the improper abuse of this has resulted in the fact that there's more and more bacteria of all kinds that are resistant to these antibiotics, because if you don't kill each and every one of a strain of bacteria, it's kind of like natural selection. There's going to be a few hardy souls that are left over who, for whatever reason, biochemical mutation, etc., are not affected or not wiped out by the disease, and they pass that trait on to not only their offspring, but in a kind of a cross-contamination, cross-sharing deal, they can share with totally different bacteria. So you had cattle being fed antibiotics, and at the same time you had doctors, MDs, DOs who, when their patients came in with a cough or whatever, demanded prescription for antibiotic. In fact, patients didn't feel like they had a valid transaction with their doctor unless they were given scripts. So there was an unspoken and yet palpable pressure on doctors to pull out that pad and write script for them. And even though they knew that if a person had a viral infection, the antibiotic would do nothing to help them, and in fact any bacteria that were left over after that course of antibiotic, if a person had a 10-day course of antibiotic, only took it for 5 days, there would be bacteria left over that now were invulnerable in essence to that antibiotic. So the AMA actually came out and told doctors, quit doing this. Quit giving patients scripts for antibiotics when they have a viral infection. But AMA is a long way away. Joe Blow is in your office, looming above you, maybe 6'4", who's paying for a doctor visit. He expects that piece of paper. So which way do you think the doctor is going to roll? Toward the AMA's distant warning, or this guy that's been a patient for 10 years? So You had the cows being fed antibiotics. You had the people demanding on them in doctors' offices. And you have the fact that bacteria and viruses evolve quickly, and they seem to evolve in such a way to fight back against those things we use against them. And like I said, the bacteria can actually, between strains, share this new immunity they acquire. So between the mutant bacteria, the ones that are left over that are hardier and happen to be resistant, farmers giving their cattle antibiotics, doctors in private practice giving them script when they really shouldn't, we're developing more and more a worldwide problem with antibiotics that aren't working against bacteria. And in fact, with the MRSA that we mentioned earlier, they used to use vancomycin, and not long ago in India they found a strain that is immune to vancomycin. So what happens is we're getting to a point where we, at some point, are going to have to tell patients, we don't have any antibiotics to give you. And as many doctors have thought about this, they've called it, going back to the Middle Ages, where the best thing they could do was, blood lead or put some leeches on you and maybe give you some sort of potion. But really, the invention of penicillin, Fleming, and then the other types of antibiotics that were conjugates of that or in totally different classes, brought about a whole different approach to treating disease, and it's been the mainstay of DOs, MDs for decades, if not centuries at this point. And if you think back to the the Civil War, a lot of guys died not from the bullets of the other side, but because of infections that they got. They had to have their arms hacked off or the leg hacked off. They got hit in the chest, and there were no effective antibiotics to counteract it. So they just died from infection, septicemia, which is, like they say, we might be going back to the Middle Ages of medicine, where we don't have antibiotics to give you. Too bad, so bad, hope you survive and hope you're not hurt too bad. So anyway, that's the skinny on the post-antibiotic apocalypse that we may be headed for. And I don't think it's scare talk. I don't think it's hyperbole. In fact, I think if you read a little bit about the background of how we got where we are, and parenthetically, we're also having TB now that is immune to all these different antibiotics. If you read how we got where we are, you're going to see that it made sense that anybody looking at this situation who was aware of, what was going on could have predicted exactly where we're at right now. You don't have to be omniscient to know that if you drop a ball in a planet with positive atmosphere, it's going to hit the ground. So hope you enjoyed the video, and I hope you're having a good day. And since we're in December, around the mid-December, if you celebrate, Merry Christmas, and if you don't celebrate, Happy Wednesday. Thanks. Bye-bye.